Hi guys, this topic about facial palsy. If you see clinically, there is unilateral weakness or asymmetry of face, drooping of angle of mouth and eyelids are classical feature of Bell's palsy. It is mostly unilateral in occurrence and occur within 72 hours of viral infection most likely. If you see facial nerve mostly supply the muscle of facial expression as you can see in this picture. So Bell's palsy is diagnosis of exclusion. It means you have to do MRI of CP angle and you have to rule out any tumor in the region of vicinity of the facial nerve. If you see this classical presentation of facial palsy, there is droopy eyelid, dry eye, excessive tearing, facial unilateral facial paralysis. In about 3% of cases, it may be bilateral facial palsy, but 97% it's unilateral. It's equal between male and female, but below 20 it's common in female and above 40 it's common in the male. Ratio is almost equal. Male to female ratio is 1 to 1. And this facial nerve also supply the some part of ear and taste fiber of entire two-third of the tongue. If see this idiopathic Bell's palsy MRI case, you see there is edema of in the area of geniculate ganglia where facial nerve is having labyrinthine segment which having less diameter, so this area is compressed so that this geniculate ganglia is hyperintense on T1 MRI image. So this is classical presentation you can see on MRI of left side of this case, left Bell's palsy, or you can say idiopathic Bell's palsy. It is the most common cause of facial palsy in overall population. Incidence is about 3 to 15 per lakh population, and incidence peak about 15 to 45 years of age. Now talk about investigation. It is diagnosis of exclusion. You should rule out other causes like systemic diabetes, hypothyroidism, and you should do MRI. And sometime you require electromyography or electroneurography to investigate the extent of nerve injury. And most common cause of Bell's palsy is herpes simplex type 1 virus. So it is identified as a viral pathology. The treatment is mainly corticosteroid. It should be given 1 milligram per kg in divided dosage up to 15 days. If corticosteroid systemic is contraindicated, you can give transtympanic corticosteroid, Dexona in the middle ear cavity so that it can diffuse up to the geniculate ganglia. Another treatment is hyperbaric oxygen therapy. If your patient is not responding with this therapy, you can add on hyperbaric oxygen therapy. Sometimes we can add acyclovir 400 to 800 milligram in QID, TDS to QID dosage, but it is not effective. So only treatment effective is corticosteroid. It should be started within 72 hours of the diagnosis or symptoms or clinical history of the patient. So this is all about idiopathic Bell's palsy. Thank you.